Transforming Healthcare in Ghana, the National eHealth Project. Ghana's healthcare system has long faced challenges in patient data management and disease surveillance. But today, a revolutionary project is changing the game. The Ministry of Health's National eHealth Project, powered by the Lightwave Health Information Management System, LHIMS, is streamlining healthcare services across the country, placing Ghana at the forefront of the African healthcare.
LHIMS has actually enhanced patients' care since its introduction because we are able to access information quickly and act upon them, providing better care for our clients.
Healthcare establishment managers have always been searching for electronic software that can do digital work for us, especially EMR, electronic medical records. We're searching for a software provider. At that time, those available were the ones that will be able to help us speed up our electronic archiving of medical records. It means that it was still paper, but we're archiving them such a way that retrieval becomes easier and then missing folders was minimized. The Ministry of Health gave me the opportunity to lead that pilot, not only in Cape Coast Teaching Hospital, but to lead it for the central region in general, because their software had embedded in it integrated referral systems such that the lower level and upper levels on referral hospitals were all integrated. We piloted it for 2 years and it was very successful. The banks that were collecting our monies, and in some district hospitals, there were cash collections. That also has its own problems because of embezzling and then pilfering and thieving here and there. But Lightwave Health Information Management System that was introduced was also able to adapt to our stores management systems such that we could know the utilization of your stores, the stocks that are available, the stock value, and how much stocks you have and how long it can last you.
Since we enrolled LHIMS, our IGF revenue, that's internal generated funds, has virtually doubled. All the leakages that we had in the past have all been sealed now, and we are sure that all the money that is billed comes to the hospital. As a manager, I also get real-time access to the finances. So as I sit here now, I can just click and know how much has been generated, and it makes sure that there's accountability. For lab services, everything, we know that because of the LHIMS, your results are always available. Your x-rays, your ultrasounds, everything is stored on the LHIMS. And the good thing is that when you go to other facilities, you can also have access to it.
One of the key things with the impact of LHIMS has to do with the continuity of care, because right now you're able to access any information from another facility and then also continue from there. And sometimes there's no need to even repeat certain investigations if the time frame is within an acceptable range. So continuity of care as a family physician is a key factor for me in here. So we are able to continue with the care that we have to give to the patient. And with the integration of the NHIS and then also with the Ghana card, then it makes it much easier even to kind of enroll clients onto the system and then also be able to retrieve their data. So it has really been very helpful in that regard.
And especially if you consider documentation. We are living in an era where patients have become fully conscious. Health providers have also become aware of that consciousness. And so if you have a system that helps so far as documentation is concerned, it makes it much better and safer. But quite apart from that, the fact that it is possible to have access to patients' data, patient information across hospitals. I believe that it is a good thing.
I remember when this system came into force, some of the senior doctors were not willing to use it because they felt that, look, they are not computer savvy or IT savvy, so they need secretaries and so on and so forth. But when they understood, doctors who used to sit and see same number of patients, maybe from 9 to 8 in the evening, they were able to see the same patients from 9 to 3. 5 full hours cut off. So obviously that affects the patient waiting time. Because if you are here to leave 5 hours earlier than you have left, that is a lot.
It was also possible to get your finances on a daily basis. How many people are paid, how many people are yet to pay, and how much they owe. So the hospital was on top. And I can tell you that when it was started, most of the hospitals got their internally generated funds, the IGF, tripled, because it was very difficult to embezzle money from the electronic system.
With the Lightwave Health Information Management System, LHIMS, patients enjoy seamless continuity of care, reduced waiting times, and improved patient safety.
Gone are the days where we're using the folders, and so storage becomes a problem. We have a heap pile of them, we have to go through them, and so it delays patients' care.
Cost of production for folders is totally out of the way now. I mean, all of that is channeled into the software that we are using currently in the hospital facility.
We have had instances where patients will come to the hospital, sometimes alone, 3 a.m., 4 a.m., just because they want to just come and queue at the records office to get their files retrieved for them. This is no more in the hospital. Because now the IT system, the computer system is such that every patient who comes in with a digital number registration, the retrieval of the electronic record, medical records of the patient is instant, And now we are also able to do very good appointment system with the patients because there's very little waiting time.
Initially, when we had to manage folders, you had people's personal information on sheets of paper that could be handled or viewed by anyone. But now with the LHIMS system, you have this in a software that you need to have certain credentials to be able to access, and so that improves confidentiality for our patients as well.
We began the hospital less than 2 years. The space for storage of folders was occupied. Now we have done away with all those folders, so we don't need space to store, paper information.
This is where we used to keep our manual folders. And it used to be a very difficult working environment. But then when we ran out of space, we actually didn't have any choice than to use this space. So this space was actually created as an underground to absorb water for the female ward. But unfortunately, when we ran out of space, keeping manual folders, we have had to make use of the space to store our patient information. And that's what we're going through. We used to battle a lot with reptiles and so on and so forth. And then continuity of, adding folders, because on daily basis, we used to still add new patients onto our stock, and that became too huge a burden to contain. So I remember when, as a facility, we heard Lightwave were deploying an electronic system. We have had to even do a documentary of the space here for regional director to see what we're going through, and apparently the region facilitated our hospital along Czech Kede Government Hospital for first deployment of the LHIMS. You have to say that this has saved us a lot of troubles. So you can even see some of the cubicles where we kept patient folders. Visibility or lighting was an issue, as you can see here. So any patient who came to the facility, we had to retrieve the patient folder from this plenty folders. So it goes along to the end there, and then we have these sub cubicles. where we kept folders according to years. So that is how difficult a challenge the manual or the folder system used to be. Now we have almost every patient folder electronically just sitting on our systems, on our computers, and I don't think anything can come handy than the electronic system.
Initially, patients' relatives go to the pharmacy holding the patient's folder to go for medications, prescribe medications for their relatives who have been admitted at the ward. But with LHIMS, they do not have to go through that stress, and then it has a form of confidentiality, because there's no way the relative will be able to get access to the disease condition of the patient or the type of medications the patient will be on. So it has served as a source of privacy and then confidentiality. Also, there are instances that initially, when you go to the OPD, you'll see nurses holding bulk of folders. But since LHIMS was introduced, you don't see that. Nurses are standing in front of huge crowd, mentioning people's names. Some of the patients listen. Some of them also will say that this is not how my name is being mentioned, and then it causes a lot of chaos. So that one too has been resolved.
Initially, when the project was brought to Kolebu, it was piloted at the polyclinic. And after the polyclinic, it needed to be implemented in the main hospital. You know, Kolebu is a very big hospital with several departments. And unfortunately, when it got to the time to implement it in the main Kolebu, it was around that time that the COVID-19 pandemic reared its head. And so virtually all the other departments were scared of starting the implementation of the paperless, because people's fear was that the use of the computer hardwares, which was going to be used by multiple staff, was going to lead to transmission of the infection and spread of COVID. So everybody was afraid to start it. And I said to myself that I will go ahead and implement it, even in the midst of the COVID-19. And so I was the first department that started the implementation at the accident and emergency. And I started it against a lot of resistance from some of the other department doctors, because they were saying that then, Dr. Kwachi, if you went ahead to implement LHIMS, we will no more come to the emergency and use the computer hardwares. We will come with folders and keep on writing, because we were afraid of contracting the virus, the COVID virus. So if we touch any computer, we are likely to get infected. Following the implementation of the paperless had shot up by over 200%. And other departments who were protesting now realize that, hey, the implementation has been successful at the accident and emergency. The A&E was making a lot of revenue, because now at this time, nobody could interfere with patients' bills. And the bills were not processed manually. The system processed the bills electronically once you were offering the services. And so there was interfering with patients' bills by human interference, so got down drastically, and therefore it shot the revenue. People could not update patient bills. People could not tamper with. If you tamper with the patient's bill, the system will register your username and your password, so you'll be caught. And so it led to significant reduction and then blockage of financial leakages. And you could review any patient anywhere. You could sit in your office and review a patient in the orange ward, sit in your office and review a patient on the red ward. And so life became so comfortable that the doctors were now resisting, realizing it, complained, informed their various heads of department that accident and emergency has been successful with the implementation. So we should go ahead and implement. So their HODs called me that, hey, my brother, we were resisting implementation, but now we have seen that you have been successful. Come and help us how to implement the thing in our department. So gradually, all the other departments came on board, and it became so successful. As we speak, every department in Kolebu is now hooked onto the paperless system, and everybody is comfortable. It's so comfortable and has brought a lot of relief. Can you imagine? We used to have cabinets full of papers. It's no more. Everything is on the system. The patient bill, once you admit or discharge at any one point, it goes to the bank and the bill is there. And the patient pays the bill. There's nothing like paper in the implementation. In clinical care, caregivers are managing everything on the system. And as we speak, one thing that is so lovely, especially for the orthopedic department, is management of inventory items like orthopedic implants and then some consumables. Before the patient goes to theater, I can sit in my office and bill the patient. And the patient pays at the bank and I can see it right in my office. So this was a breakthrough in clinical care that I think, congratulations to the initiators of the paperless. At the moment, life is so convenient. It has shortened service time and service delivery. Turnaround time has jumped several fold. Every doctor and every nurse or pharmacist is on the system. Everybody is operating. In fact, in the whole hospital, accident and emergency was the first department that started the implementation of the paperless LHIMS system. And it was against a lot of resistance, A lot of the doctors who come and review their emergency were refusing to use the hardware, the computers and the tablets, and were coming with folders in their holding folders in their armpit. So I went ahead and implemented it, and following the implementation, it became so successful. No, not a single person in accident and emergency got COVID-19. Neither did anybody die from COVID-19. And for your information, the department procured its own computers, even though the project came along with some computers which were not enough. So we went through procurement process and bought it ourselves with our own budget to start the implementation.
The LHIMS has brought a lot of financial gains to us as a hospital. It's able to capture all clients and thereby improving the revenue generation of the institution. Through the LHIMS, we've been able to do some savings that have enabled us to expand on the ICT infrastructure that we have. Since its inception, I think we have brought over 600 computers, over 20 Cisco switches, access points, and this is all because our revenue generation has increased.
I can confidently say that since the introduction of the paperless system, which is LHIMS, patient time has reduced drastically or significantly, because previously we used to go all the way up to the ward level to look for folders. There were times that you could come, we will not even see a folder, and we'll have to issue a new folder. And in that case, the patient's records is somehow lost like that. But with the introduction of the LHIMS, there is continuity of care. Records are not lost, they are safe. But with the introduction of LHIMS, the LHIMS numbers are very, very unique and highly specific, allocated to each person. So it makes retrieval of patient documents very, very simple.
If I'm Benedict Alabi, I'm at the Meba Hospital. First, now you use folder. Folder, no. If I now bet chocho, da. System no so there. Onya share away na wa enter na there obiano. Nia obeti answer or say ko next baby I was say
But previously, Jake, you come and sit down in the line, and with your folder, people will be coming in, crossing the way, and you are still sitting down without any name being called. So looking at it, the computerized system, I think, is much better.
You could have a patient, especially patients with chronic illnesses, who come routinely for checkups. You could have them having multiple or duplicated medication. Now with the LHIMS system, whenever a medication is re-prescribed, you get an alert for you to cross-check to ensure that you are giving the patient the right medication. So that is to say that the LHIMS has given us the opportunity to be able to see the patient's diagnosis, prescribed medication, and even the dispensed medications for patients, which has improved patient safety and has reduced medication errors.
Electronic medical records are now accessible in real time, enabling healthcare professionals to make informed decisions.
Those times you are waiting for, you don't know where to get labs, or they go there and then they have to carry a paper. Now everything is one click, and then they get it done. You sit at one click, you get your results. So we are able to sort out cases or patients very quickly. So they are not, they don't sit for too long in the queues before they get sorted out to go home.
The system's early warning disease surveillance capability detects potential outbreaks in real time.
I would say it's the base, because it tries to eliminate the human factor and introduces automation. And so typically what happens is that you have people going to a health facility and presenting with a set of symptoms, and the doctor will examine and find a certain set of signs. So with this set of clinical features, the doctor will come out with a diagnosis. And then if it's a kind of epidemiological condition, we now put it on what we call our case-based form. So that one is somehow at the discretion of the doctor. That's the superior part of LHIMS. So let's say somebody comes to the hospital and he has diarrhea and he gets dehydrated. At that time, the doctor can decide that the diagnosis is gastroenteritis. Gastroenteritis, it's not a public health problem, but we have built a set of criteria that says that when you have a diarrhea and dehydration, it's suspect cholera. In that case, our alert system will be sent to us. That will help us suspect cholera. So to us, that is the advantage that LHIMS has, which we find interest in. So if you look at the dashboard for let's say for LHIMS now, there are some tabs that so if you look at, let's say, the surveillance data tab, that one will give you an idea of all suspected cases. So let's say for this one, for this period of I will say 23rd October to 30th. So this is what clinicians have suspected to be, let's say, cholera. And so far as you make that diagnosis, clearly it comes on this dashboard that we'll see. So for that period, you can say that it is 31 cases that we have suspected. So it is not the doctor telling us, but clearly so far as he made the diagnosis, we're able to visualize it on a dashboard. The other issue is where the alert comes in. So this is where the doctor has made a diagnosis, but assuming the doctor does not make a diagnosis, and by way of his examination findings, we see diarrhea, we also see dehydration. We have this alert that diarrhea with dehydration is somehow equal to cholera. That will give us a better sensitivity of the suspicion. So here we realize that if we have, let's say 31, if you decide to now go to our customized surveillance data for the same what you think should be cholera, you realize, let's see what we are going to get. So for that expanded system, let's see. So in that case, our system is, we now have to now probe further that how many of these suspected cases are cholera. So that is the superior part, because here the doctor does not even suspect cholera, but because we are putting an alert system that says that diarrhea with dehydration is cholera, we will now go for that, and that's how we think that LHIMS supports our cellular system by improving the sensitivity for us. So for us, I think one thing I need to state is that our initial concern was how expansive is LHIMS, but now with over 400 facilities, I think that we are ready to go. Hopefully, we intend to scale it up to involve the regions. The regions will have their own dashboard, and then the big facilities will also have their own surveillance dashboard, and follow. And we will now go on to really look at dashboards at the national level. So that's the way we want to move on with the LHIMS with respect to the surveillance systems.
The advent of Lightwave has been very, very helpful. Lightwave has been deployed in so many facilities. Now, in terms of screening for tuberculosis, it is electronic. Patients walk in, patients are interviewed systematically, and then they are presumed and they go for testing. Clearly, we've got all our indicators on the Lightwave electronically, and then retrieving this data is easy and is so fast. So clearly, we don't struggle much. All our paperwork have come into one and then electronically captured. And so one key thing is also about, you have to screen for TB before you move to the next step. And that is good for us.
So when you suspect malaria, you put in your provisional diagnosis. You select the malaria, falciparum malaria, unspecified, but you don't confirm till you do the labs. And when you do your labs, you select the various labs you want to do. When the report comes back, see, the good thing about the LHIMS is the labs don't come to you with, the patient doesn't come with a paper. Everything is already in the system. You just input the patient's code, then you see everything. Then when you get the results, you can then treat and manage the patient effectively. The good thing about this is, as you're getting the results, automatically LHIMS also sends a report, just like you selecting your diagnosis and your provisional diagnosis. It also sends a report under the same patient's category, showing that, oh, there's a lab done that confirms malaria. And this all this makes the testing, treatment, managing and tracking of the patient very effective. So I believe in East Municipal Hospital, we are very fortunate to have this system working efficiently and effectively, and it has helped us in delivering the best care to our patients.
For the introduction of the LHIMS, we had a lot of challenges because we were in a paper-based system where all the results has to be printed. So in a test where you are using an analyzer, you have to finish your test, go through your procedures, and then print the results out, send it outside and mention patient's name for the results. Those that were not based on analyzer, you have to finish the test, go and sit behind a computer, enter them manually, one after the other. But now with the introduction of the LHIMS, this is quite easier, because when you are done with the test, sitting behind the computer and by the click of a button, a clinician will have to get hold of the results. The patient doesn't have to even carry the results with them to the consulting room for the clinician to see. By entering it on the system, the LHIMS will directly get the results to the clinician for them to work on as soon as possible to save life.
A critical component of our performance is turnaround time. LHIMS specifically is able to give us a tracking of how long it takes for when somebody comes here to do a lab test, the period from when the sample is received to when the result is given out. And so we are able to track our performance, and it helps us to meet better the needs of our clients. We are able to restrict the validation of laboratory results such that we have levels of verification, and to ensure that the results come out without any error. Some systems only allow for a one-level verification, which sometimes is challenging, but LHIMS gives us opportunity to improve the quality of our
institution. I must say that one of the good things that LHIMS has brought about to us as Ghanaians is to improve our referral systems. So somebody who is being referred from a primary or secondary health facility or level is able to have his or her information ahead of time within the teaching hospital space. So that helps in the continuum of care and is able to help us to keep the gate very well.
They referred a patient from, I think, Doma to this place. We had already assessed the patient's folder and everything was there. So immediately the patient came in, we didn't go through past history, whatever it is, to prolong the care. And immediately the patient was attended to, and it was very interesting.
Because records are not lost now, everything that is done with respect to the patient stays on the system. So I remember once when they needed to make a blood transfusion, the records of the patient that had had a previous blood transfusion alerted us on the group that it was, and because we had that information, we needed to do a double check. So we had to send back the blood to verify again, and then it came out that the first information that was on it was the correct information. I must say that this is life-saving because we anticipate what could have happened, and then we averted the possibility of the complication.
We have seen a lot of improvements. The LHIMS came to expand our ICT network infrastructure. They add on with our intelligence, they give us intelligent switches, which give smooth running of the software. They give us a very good server, HP server, with a very good specs. That makes smooth running of the system. They give us 2 servers, 1 database, and 1 of the application servers.
In summary, Lightwave Health Information Management System, LHIMS, is changing the landscape of healthcare in Ghana by improving access to records, reducing wait times, and enhancing the overall quality of care while promoting financial efficiency. Lightwave Health Information Management System, LHIMS, a holistic healthcare platform for a healthier future.
Every hospital and healthcare establishment in this country get to know the benefit. This LHIMS that we roll out.
Lightwave Healthcare Solutions.
Digitally transforming Ghana's healthcare, empowering healthcare.